Welcome everyone to this Peace Talks webinar. Thank you for joining us today. Our topic is the COVID-19 crisis and its impact on families. So we're very, very happy that you're with us. We have a distinguished group of panelists that I think will stimulate us and inform us well about how this crisis is impacting families, the basic fundamental unit of society. This is May 15th. It's within the United Nations calendar. This is the International Day of Families, a day set aside by the UN since 1993 that has each year a specific theme or topic. Just by way of example, over the years, topics, last year's theme for the International Day was Families and Climate Action. 2018, Families and Inclusive Societies. 2017, Families, Education and Well-Being. 2016, Families, Healthy Lives and Sustainable Future. And 2015, Gender Equality, Children's Rights in Contemporary Families. And on, going back to the 90s. So this is something that UPF tries to honor each year because we do underscore the importance of marriage and family. We do have an Office of Marriage and Family that is strong and active, particularly at the United Nations. The theme of this particular International Day of Families, 2020, is Families in Development. And I think this has been a theme of the UN's focus on the family going back to the 80s. And families are understood as central players in the achievement of the Sustainable Development Goals. This year, the theme is Families in Development, Copenhagen and Beijing 25, which is referring to the Beijing Conference on Women from 1995 and the Copenhagen World Social Development Summit and a Copenhagen Declaration. Just reading from the document about the International Day of Families this year from the UN website, and I encourage you to have a look at un.org and look for International Day of Families. It says this year's 25th anniversary of the Copenhagen Declaration and Beijing Platform for Action comes at a time of one of the most challenging global health and social crises. The 2020 COVID-19 pandemic brings into sharp focus the importance of investing in social policies, protecting the most vulnerable individuals and families. It is the families who bear the brunt of the crisis, sheltering the members from harm, caring for out-of-school children, and at the same time continuing their work responsibilities. As the world struggles to respond to the COVID-19 crisis, there's a real opportunity to rethink and transform the way our economies and societies function to foster greater equality for all. In doing so, it is clear that gender equality will not be achievable without gender equality in families. And that on this, as so much else, the Beijing Platform for Action continues to provide a visionary roadmap for where we need to go. So there's a lot of great literature that you could refer to, and but I wanted to acknowledge the occasion for this webinar with its focus on the impact on families. Several of our webinars have addressed the COVID crisis because it's something that's pressing on us all. Please, if you have questions, you may email them to peacetalks@upf.org. And then those questions will be, as many as possible, will be read out after the initial statements of the speakers. This webinar will be recorded. It will be posted on the UPF website, and it will be available on YouTube. We do have translation into Russian. That was the only request we had, and there is an icon at the bottom of your page where you can select translation. Without further ado, let me turn to briefly introduce our three panelists this morning. We're very proud to have them and grateful that they made time for this morning. The first is Dr. Bahira Trask, Professor and Chair, Human Development and Family Studies at the University of Delaware. She's researched fields in areas such as economics, women, and family life. She's authored a publication entitled Global Trends in Gender, Work, and Family, and another entitled Globalization and Families, concerned with issues such as mental health issues and domestic violence, the importance of family relationships and social ties for human development. Thank you for being here, Professor Trask. Our second panelist is Dr. Rima Salah. She is a former Assistant Secretary General at the United Nations, a former Deputy Executive Director of UNICEF. She served on the United Nations High-Level Independent Panel on Peace Operations and has co-edited a volume called Pathways to Peace, Transformative Power of Children and Families. Very concerned about the impact, the response to COVID-19 for families and children in fragile and conflict-affected settings. Our third panelist is Professor Claire Huntington. She is the Joseph M. McLaughlin Professor of Law at Fordham University. Her expertise is in family law and poverty law, author of Failure to Flourish: How Law Undermines Family Relationships. She is focused on the family law issues in the US in relationship to COVID-19, the problem of rising domestic violence during the time of sheltering in place and social distancing, custody issues, problems of child abuse and neglect. I'm looking forward to this panel. I would now like to give the floor to our first statement coming from Professor Bahira Trask. Professor Trask, you have the floor.
Thank you so much. Good morning, everyone. Thank you to Lynn and Tom Walsh for inviting me to participate in this important webinar on COVID-19 and families as we commemorate the United Nations International Day of Families. I have spent my whole career studying families and the policies and programs that are needed to strengthen and support them in many different contexts. However, there has never been a period in my lifetime where the needs of individuals and families has been more conspicuous or more critical than in the last 2 months. We could take this discussion in many directions, but given the limited amount of time for this introduction, I would like to primarily focus on working families, and in particular, those caring for young children, individuals with disabilities, individuals with long-term illnesses, and elderly persons. I know that many of you who are listening today are yourselves parents and/or caretakers struggling to balance work, care responsibilities, and self-care while keeping worries, your own and those of your loved ones in check. Most families are dealing with a variety of issues, including figuring out the quote-unquote new normal as schools and daycares are closed, or even finding a physical space in their homes to work, as there is not always an obvious or accessible place. In addition, parents are dealing with raised anxiety in children and/or tensions in partner, marital, and parenting relationships, as well as at times loneliness and even just uncertainty, because right now there is no real end to this phase. That said, the differences in these experiences are particularly striking when looked at across the socioeconomic spectrum. So for instance, many middle-income and high-income families are struggling. They're having to conduct their work remotely and at times are being held to an even higher standard because their employers believe that they have more time on their hands. And by the way, I just saw on the news this morning that some companies are now hiring private detectives to make sure that employees are actually working while they're working remotely. This is all happening while parents are homeschooling their children and absorbed by other caretaking and domestic responsibilities. However, the groups that have really been hit the hardest by this pandemic are poor families, working class families, and families of color. Early empirical evidence indicates that the health and economic impacts of the virus are being borne disproportionately by these groups. For example, homeless people, because they may be unable to safely shelter in place, are highly exposed to the danger of the virus. People without access to running water, refugees, migrants, or displaced persons also stand to suffer much more from both the pandemic and its aftermath, whether due to limited mobility, limited or no access to healthcare, fewer employment opportunities, increased xenophobia, etc. Working class families have also been profoundly affected. Just as an example, the findings of one of the first studies on the effects of the crisis has just come out by researchers from Columbia and Duke University. They were in the process of conducting a major survey of service workers just as the crisis occurred, and during this period, 41% of their participants unexpectedly lost their jobs. Most had little to no savings and reported that they will be able to pay rent or their mortgage for no more than 2 months, and the same is true about buying groceries. Equally disturbing is that both parents and their children reported a deterioration in their mental health since the start of the pandemic. There was a 67% increase in the share of parents who felt anxious or depressed all day, and children exhibited a 42% increase in externalizing behaviors. Previous research has indicated that when there are economic downturns, mental health deteriorates, even without family unemployment. And these effects spill over to other domains, such as achievement gaps, lower test scores, and often then lower college attendance. Also, health disparities increase. This is particularly the case for communities of color, who are subject to a wide variety of these and other consistent stressors. I want to point out that we've seen a correlation between these types of outcomes based on economic data. Now, coupled with the health aspects of the pandemic, the outcomes are likely to be much, much worse. My personal concern is that besides the significant economic and physical health crisis that we are currently in the midst of, we will have an even more overwhelming mental health crisis. This will be the case for people living with their families or others they are close to, and also for the many individuals who are alone, including the elderly. While social distancing is a necessary measure to reduce the spread of the virus, the increased social isolation of elderly persons at a time when they may be most in need of support is extremely worrisome. I do not want to end this discussion on such a depressing note. I want to point out that for some families, there have been positives in this situation. In my small circle of acquaintances and in my own neighborhood, I have seen families walking together, playing together, and in general, just enjoying the bonding time that escapes so many people who are always working and rushing around, which is so endemic in contemporary Western societies. Thus, what we see is that while this is a global pandemic, its effects are highly individualized. Thank you, and I look forward to our discussion.
Thank you, Dr. Trask, and I'm grateful for your realism of portraying these critical problems that are affecting families, but also some of the silver linings that are there. If I could just ask one follow-up, are there any implications as you see the impact on family if you'd venture toward policies or best practices or vision of how our world might improve to address these problems longer term?
So I just want to apologize because my discussion was really based on research that has American-based research. This is a global pandemic. It's playing out in different ways in different parts of the world. But even I have colleagues all over the world who I have been in touch with. And even there, it's different for different individuals and families. One of the best policies I've read about is that in England, what they are doing is the government is helping employers by giving them funds to keep their employees paid at 80%. And that is really helping relieve some of these stressors. I think in the United States, a huge problem has been that, like I cited the study, people have lost their jobs. They don't know where their next livelihood is going to come from. And it's not just everybody's waiting for, a solution, a vaccine to the pandemic. We're expecting a major restructuring of the certain aspects of the economy. For example, the service sector, the tourism sector, different parts. And this is promoting the anxiety. So people are fearful they could get sick, but they're even more fearful that they don't know how they're going to feed themselves and their families.
Yeah. Well, thank you. And I think in the later discussion period, we can return to some of this, but I very much appreciate, we have quite a very global international audience, and I think they very much appreciate your reference to the global context. But moving on, I want to welcome Dr. Rima Salah to take the floor, and we look forward to hearing from you, Rima. Thank you for being here.
Thank you, Dr. Walsh, and thank you for the invitation. It gives me a great pleasure to be with you this morning, afternoon, or evening. And I say to all of you, good morning, sabah al-khair, masa al-khair, and bonjour. On this very auspicious occasion, the International Day of Families, it is the time to pay tribute to all the families across the globe and honor them for their religion and also their great efforts, heroic efforts, to protect their children and safeguard their well-being during the global pandemic humanitarian crisis. I will speak today on the response to COVID-19 for families and children that live in fragile and conflict-affected settings and the importance of early childhood development. The COVID-19 outbreak exacerbates existing crises and further violates vulnerable families and children's rights. We know now that 250 million children live in areas affected by conflict. We know that 29 million babies globally were born in areas affected by conflict in 2018. And an estimated 3.7 million children live in refugee camps or collective centers. And now we have 60% of all children live in countries with a full or partial lockdown due to COVID-19. But for families and children living in conflict, affected and fragile settings already that struggle with limited access to health services, including vaccination, and virus-related containment measures negatively and impact their already volatile safety and access to education. With schools and childcare centers closures, young children learning, nutrition, and hygiene suffers. For hundreds of millions of children, these closures can mean going without day school meals, clean water, and sanitation facilities. Pandemic-associated movement, restriction, and economic insecurity are likely also to increase child labor, sexual exploitation, and trafficking, thereby perpetuating cycles of violence. Furthermore, more children and abusers than ever are online and heightening the risk of exposure to cyberbullying, hate speech, and sexual exploitation. Hence, there is an urgent need to protect children from violence amidst the pandemic, which compelled in April 22 leaders of UN agencies and international organizations to call for united effort to protect children in this crisis. As to families and children on the move, even in the absence of pandemic, uprooted families and children, those living as refugees, migrants, or internally displaced persons face immense barriers to accessing health services and sanitation. The rapid spread of COVID-19 and the containment measures are worsening this already situation, making migrants and refugees disproportionately vulnerable to exclusion, to xenophobia, to stigmatization and discrimination. We know that in camps or in overcrowded detention centers, they often live in deeply unsafe and highly stressful environment with no possibility of social distancing. The pandemic also poses greater challenges for migrant and displaced children and families as they are faced with higher rates of deportation and expulsion. These practices threaten children's rights and are at risk to public health. So what does science teaches us on the importance of early childhood development in the context of COVID-19? The COVID-19 pandemic has produced huge societal public health and economic challenges across the globe. Although there is still a great deal we do not know, infection disease experts have already outlined the steps we all need to take to limit the spread of the coronavirus. But we know that children are in many ways the hidden victims of the pandemic. Parents and caregivers are in the first line of response to protect and support their young children, particularly in a crisis such as the pandemic. Consequently, separations from primary attachment figures like parents, like families, like caregivers, due to illness, to hospitalization or death, will have immediate harmful and long-term effects on a child. Adverse effects also result from economic losses, from lost wages and jobs, to associated food insecurity and the potential loss of housing. These factors are compounded by the psychosocial stress experienced by families, by parents, especially mothers, which seriously undermines their mental health. This is also greatly exacerbate the adverse effect. As a result, hundreds of millions of children are now growing up in the environment conducive to toxic stress, which can impair their development and will likely prevent them from reaching their full development potential. Now, in the response to COVID-19, for families living in fragile contexts, the Early Childhood Development Consortium, which is a global movement of United Nations agencies, civil society organizations, academia, and practice, stand in solidarity and collaborate with the UN Secretary General, with UNICEF, with WHO, UNHCR, and all United Nations agencies, as well as with governments, non-governmental organizations, and all of you, to mitigate the impact of the humanitarian crisis on families and young children. The Early Childhood Development Consortium recommends immediately to invest in quality programs and services for families and their young children that live in situations of violent conflict, military occupation, and displacement during the COVID-19 response efforts. To ensure the essential child protection services are recognized also as life-saving and continue to be provided and accessible. To prioritize protection of families and children who in this time of crisis are susceptible to neglect, abuse, and exploitation. To use mass media, radio, television, and social media to promote psychosocial support to families and children. Also, in the medium term, we recommend that to ensure an inclusive approach for all children and their families, especially also migrants, refugees, and internally displaced persons who have a right to the highest attainable standard of health, including having access to testing, early detection for COVID-19, and the means to physically distance, self-isolate, and take other appropriate physical and mental health measures. To uphold also the rights of vulnerable children and their families. As we emerge from this pandemic into recovery, it is vital to have programs that benefit the families, the children, the communities, and the institutions. And those programs should be culturally sensitive. In the long term, we continue to build on the extensive body of international research on the power of early childhood development to promote peace and sustainable development. Finally, in this global pandemic that warrants the participation of all members of society for containment, and where inequalities become starkly evident and pose greater risks to the vulnerable, engaging families and children is imperative. Early childhood services can be a cost-effective and sustainable way to empower families and communities to interrupt the cycles of poverty and violence, as well as to build resilience and social cohesion, and to build a world of peace. Let us join all in this movement to build a world of peace for all families and children across the world. I thank you.
Well, thank you, Dr. Rima Salah, for that very well informed and passionate call to action. You elaborated really on many specifics and underscored a theme that is being articulated well in this webinar, the disproportionate impact on the vulnerable and those in fragile or conflict situations. We might say the global South. I'm wondering what you think about one of the additional problems is the getting accurate data in fragile, vulnerable contexts, refugee camps, and very poor developing nations. Any thoughts on that?
Yes, I think we, in this, we are working very closely, of course, with, for example, UNRWA for the Palestinian refugees and with UNHCR for other refugees. And that's why we work very closely with organizations and also local institutions and local universities to have the data. I know it is very important, but we have from our, because as I said, we are a consortium and we have members, and we have many members in these parts of the world where many refugees are living in refugee camps and also in other centers.
Well, thank you, Dr. Salah. We'll now turn to our third and the final panelist. That is Professor Claire Huntington. She again is the Joseph McLaughlin Professor of Law at Fordham University here in New York City.
Wonderful.
Professor Huntington.
Thank you so much for having me. It's been really wonderful watching the chat and seeing all the different places where people are around the world. And so to me, that's one silver lining of this is we're all so much more comfortable now with this technology. And I'm really grateful to Zoom and other forms of technology that allow us to be able to connect during this time. So it's wonderful to be with you today, and thank you for having me. So I'm the lawyer on the panel, and we'll talk a bit about family law. My expertise is definitely in the United States, and I'll be talking about how this is playing out in terms of family law in the United States. But the truth is, the issues that I'm going to focus on, domestic violence and child abuse, are worldwide problems and are being exacerbated, around the world because of COVID-19. So the main message I'm here to talk about is that in many of the ways that Dr. Trask mentioned, COVID-19 has posed all kinds of challenges to families across the income spectrum. But also, as she said, and also as Dr. Salah said, it's really been just devastating for vulnerable families. And so we can think about this in two ways. Really what it's doing is exacerbating inequalities among families and hitting hardest, at least right now, hitting hardest among those families who are most vulnerable. And it's also exacerbating challenges within families. And again, particularly, I'm going to focus on family violence. So I want to talk about three aspects. The first will be a bit about the economic the picture, and then I'll talk about domestic violence and child abuse. So certainly in the United States, the families who are being hit the hardest economically are middle and lower income families. So we have just millions and millions of people who are filing for unemployment benefits, who are not able to feed their families, and have lost their jobs, and in all the ways that Dr. Trask was talking about are facing a sort of immediate economic impact from this. There'll be an economic impact for almost all families, but this is an immediate and really quite devastating impact. Families are then also experiencing the stress of trying to homeschool their children, for those people who do have jobs, trying to work from home, while also taking care of children of all different ages. And then the social isolation, right? So this is extraordinarily, it is isolating. And unfortunately, those different factors, economic stress, social stress, and then social isolation, are really create the perfect storm for violence within the families. So I think about this, oftentimes we have this image of the family and the home as a place of refuge, ideally a place of refuge and support, but for many families, the home is a place of violence for both adults and children. So, part of, and Dr. Walsh, you mentioned data, and the truth is we have very mixed data and incomplete data at this point, partly because it's still very new. We're still trying to track and understand what's going on in families, but also because it's just hard to know what is going on. Always, families are a bit of a closed book. It's hard to know what goes on behind closed doors, but the mechanisms that we rely on are not functioning right now in ways that I'll elaborate on. So in terms of domestic violence, there certainly is some evidence that it is increasing around the world, right? There's evidence of a global increase in domestic violence. And again, sadly, this was quite predictable because of the known risk factors for domestic violence: economic stress, social isolation, and other factors, all of which are exacerbated by COVID-19. So we definitely have evidence that it is on the rise. At the same time, we really don't have evidence yet of the scope of the problem. And that's because Many people are reluctant to, again, often for very understandable reasons, reluctant to call in any kind of outside support, whether it's law enforcement or other sources of support, to try and have help with the domestic violence. People are trapped in homes, and just to be able to access basic resources. I mean, people to be able to go to a shelter or to be able to find some kind of support is extraordinarily difficult. So again, although we certainly have evidence that it is rising, I really think we don't know the full extent of the problem. Now, similarly with child abuse, what's interesting with child abuse, these are the same risk factors: social isolation, economic risk, and whatnot. But with child abuse, at least in the United States, this is not true in every state, but in some states, we're actually seeing lower reporting rates of child abuse, but that's not good news. What we know is that often the way our system works is that there are certain people who have to report if they think that they've seen or have evidence of child abuse. So those are doctors, teachers, and other individuals who work closely with children. But those people are not seeing children right now. So schools are one of the main sources where we get reports about child abuse. But kids are not going to school. And so we are not able to screen to know what's going on in families. Now, unfortunately, there are other indicators to be able to tell us what the extent of, or at least some sense of the abuse that's happening. So for example, hospital visits with injuries to children that are consistent with child abuse. And certainly there's some statistics showing that those are increasing. So again, it's clearly happening. We just don't know the full scope. And it just poses a real challenge of how can we best respond, but also respond, and really my co-panelists have been talking about this, respond in a way that supports families rather than penalizes families. Because many families, people are trying to do their best, but they are facing extraordinary stress. And so the question is, how can we help parents and other caregivers during this very difficult time, rather than swoop in and sort of say, oh, you're doing a terrible job, we're just going to take your children away from you. The final thing I want to talk about, law related, is access to courts. So courts, at least in the United States, I don't know what's happening in other countries, but courts in the United States, at first, so just taking the family courts, for example, at first were operating, only taking emergency cases, and now are slowly beginning to reopen and be able to handle a larger caseload. But in the best of times, these courts are extraordinarily stressed. And this has really posed even a new set of challenges of being able to give access to courts, and so people can be heard, because obviously everything's happening remotely right now, and then how do the courts actually function themselves? So that is an enormous one piece of the problem. But then another piece of the problem, of course, are the social services and all the supports that we try to give to families. One resource I just want to point out to those of you who are particularly interested in child abuse and the effect and what's happening in the legal system. This is something that's actually focused on the United States, but again, may have some pieces that would be useful to folks in other countries. Columbia Law School has a publication that's available on the web. You can just Google it. It's called Law in the Time of COVID-19. And there are chapters on many, many different legal questions, but one in particular by a really terrific expert in the United States named Jane Spinnick, who is one of the teachers at Columbia Law School. She has a wonderful chapter, sobering, but very useful chapter about child abuse and the legal system. So I point you towards that. And I just want to close again by underscoring that unfortunately, the hallmark of the United States is one of extraordinary inequality among families, and that children have radically different experiences and trajectories based on their family circumstances. And so I just to give you one flavor of that, what's happening educationally. So about 90% of children in the United States go to public schools. Some of those public schools, again, the ones that are better resourced, are handling the pandemic well enough and doing what they can to be able to support children. But there are many, many schools that are so deeply under-resourced. So both the schools and then, of course, the families themselves. And so it is really extraordinarily difficult to provide any kind of education to families. So there was a story the other day talking about one school system. We know we're on any given day, about half of the children in the classroom are showing up. And when I say showing up, the school's only being offered for an hour a day anyway. So there's children just really aren't getting access to education. But by comparison, there are many children who are in very well, or not many children, a small percentage of children who are in very well-resourced, either public schools or more often private schools. And those schools are they're able to provide more education online. The children themselves have the tools, whether it's a laptop or whatever it is, the parents who are there to be able to help support them. So unfortunately, COVID-19 is only further exacerbating existing inequalities. I wish I could end on a more positive note, but I guess what I would say is, at least in the United States, I feel like what this is doing by exposing these existing inequalities, it's at least leading to somewhat of a greater recognition. And then also the fact that this is affecting everyone, but is having a negative economic impact on a very broad swath of society, is leading to, I think, a greater openness to support for families. So again, thank you for having me. I'm really grateful to be with all of you today.
Well, we're delighted that you're with us, and thank you for that very well informed and enlightening presentation. Thank you for referring to resources such as the Law in the Time of COVID-19 publication. And in some ways we hear that the good news of the crisis and sheltering in place is that families are closer together. And ironically, the bad news is that in some cases, families are closer together. And there are, as I heard someone from the Office of UN Office of Drugs and Crime, who was on a recent webinar, talked about the good news of the reduction in street crime, but the increase of domestic crime. And this gets coupled even with alcohol abuse and drug abuse, boredom, depression, all of these factors kind of coming to the fore. I guess if I'd just a follow-up, and you were touching on this at the end about, in some ways, this crisis is calling attention to issues that we're aware of, like not only inequality in the United States, but we could say global inequality and the North-South, global North, global South, the differences, or even in Europe, it came out some differences in, the countries of Europe, North and South. Lessons learned. I mean, what do we take away from this? We keep talking as if this is going to end in June or something, but we don't know for sure. But assuming we're going to come forward, do we come away wiser and better able to develop policies and law that improves the situation?
Great question. I hope so, is the short answer. But I think one of the lessons we're really seeing is the importance of basic infrastructure, certainly a public health infrastructure, but also the importance of engaging in, in investing in families and individuals just fundamentally in health, right? So again, if we have certainly in the United States, but also around the globe, unequal access to basic health care. So what we know about COVID-19, of course, that's much more devastating for people with underlying conditions. And some of those are certainly exacerbated by lack of access to health care, or simply the lives that people are forced to live because of other conditions. So I think a real focus on prevention and infrastructure, and one piece in particular I wanted to talk about that Dr. Salah focused us on was early childhood education. That is something that really the evidence only points in one direction, that it's really important and critical for children. And so if, it's one thing not to go to school for a few months when you're a little bit older, but the importance of supporting families with very young children is really critical. And so I think we will come away with an even greater renewed appreciation for that.
Well, thank you again, Professor Huntington. Let's go into gallery mode, and I would invite our three panelists, if there was anything that stimulated you or a follow-up comment or question to each other before we turn to the audience. So would either Dr. Trask or Dr. Salah want to comment on what Professor Huntington said, or shall we just move on to the Q&A?
I'd like to thank the panelists. I thought the presentations went together really well and were really, really interesting. And like Dr. Huntington just said, I mean, families ideally are loving places, but not all families are. But I do want to say that this is, like I said, a very individualized experience, because for some families, they've bonded more. And in other families, there are increased tensions. I was just reading, they're expecting the divorce rate to go up because, some people are just so tense with each other. I do want to make one completely different point that we haven't talked about at all, just because there are so many subjects to touch on. But the World Bank is estimating that this pandemic is going to push around almost 50 million people into extreme poverty just this year. And so what's going to happen is the gap between countries, within countries, and between countries is going to grow. So the projected, this new poor group, it's projected to be primarily in sub-Saharan Africa and in South Asia. So I don't want us to forget how vulnerable so many people are, and we are going to have long-term effects from this pandemic.
Just to say that I was also, to hear you, Dr. Trask and Dr. Huntington, to see that the vulnerabilities are the same in all regions, and particularly the impact of COVID-19 on children and families, particularly on child abuse, on also violence against women, which we didn't talk a lot about it, but the vulnerabilities are the same in all regions. And I would like to really work with you and see, and maybe have a discussion. I live in New York and you are not very far, and we can work together.
Good idea. Well, we have 300 people tuned in to listen to you today, and some of them have submitted questions. We probably, I'm sure, cannot get to all of them. We only have about 12 minutes remaining, but I'm going to ask Dr. Bill Selig to introduce the first question. We'll try to keep our responses brief from the panelists so that it will allow more questions to be brought forward.
Thank you, Dr. Walsh. Panelists, you have given excellent presentations. There are obviously some common themes, particularly the issue of domestic violence, and that's being brought up by a number of our people watching. People are asking more specific or more concrete coping skills. What type of coping skills could we suggest in the issue of domestic violence or child abuse, beginning with Dr. Trask, if you could address that question.
It's a very good question. It's really not my specialty area. I think the other two panelists are more qualified to answer this question. But I do think in general, teaching conflict resolution skills is a useful skill for everybody. So I think that's one way. And then I think, just getting the word out about support systems that are in place, hotlines, the advantage of our virtual world is that you can connect with the outside. So I think for vulnerable individuals, finding easy access to those kinds of supports, that needs to be spread through radio, through the internet, through television ads. That is a way to reach people who are in very difficult situations.
Mm-hmm. Yes, thank you. Yes, thank you very much. Also, it's very important to say, and I didn't say it earlier, the protection of women and girls' rights in particular and without discrimination, and particularly to support community-based action is very important. This favors their empowerment. Even in refugee camps, we have programs that are led by either UNRWA or UNHCR and others, and UNICEF and others, that to really empower families and communities. So to build the resilience, and I think this is very important. As you know, UNICEF and WHO have also on their websites a guideline for families and children to show parents how to cope in this very difficult and trying times. Mm-hmm. So we should look at also at those websites.
Very good. Claire?
I would just underscore what everyone else has said, which is that both the social service and the legal organizations really around the world have pivoted to be able to understand that how people are going to access them is through the web. And so there are quite a few resources out there. Obviously, if you need help for your individual country, you could be looking at organizations within your country. But the truth is, in terms of many of the broader, whether it's articulation of coping skills or just basic supports, those don't have to be country specific. And so the web really can be an extraordinary resource to help people.
Mm-hmm.
Very good. Let's go to the next question, Bill.
Yes. This regards a question regarding the work-family imbalance, the tendency to value work over the family. What do we need to help families now and in the future to create a more family-centered society? Dr. Trask?
This is a complicated question, and it's actually dealt with in very different ways in different parts of the world. I mean, here in America, we have very much the ideal worker model. The ideal worker is accessible to their job 24/7. I mean, I get texts at 11 at night from my job. So with people expecting an answer right then and there because they see it as an emergency. Right. Because of my own experiences, one of the things I've done is I don't send emails and texts at off hours, after, let's say, 7 in the evening and on weekends. There are little things we can do. In terms of major ones, we're seeing the incredible need for family leave policy, some sort of emergency funds that employers have that they can help their workers with. Share jobs that have benefits, like job sharing that has benefits attached with it. Most of those policies are in place in many of the European countries and many of the high-income countries around the world. But we are really promoting this, hyper-capitalist, you're always working, you're always productive model. And we need to really, I think that this is kind of putting a stop and making us rethink some of that.
Yes. Anyone else would like to answer that?
And the one piece that I would add, and this is consistent with what Dr. Trask is saying, is that, again, we see differences across the income spectrum. So upper income families face extraordinary pressures of trying to balance work and family, again, with a sort of 24/7 email and demands and whatnot, but particularly for families at the lower end of the income spectrum, where you may be working multiple jobs with long transportation, as she said, very little, usually no access to paid supports and whatnot. So it is, it's an extraordinary challenge for all families.
Bill, I see a question here. It might be interesting if I could jump in. And it's from Mr. Hassan from Sweden, but asking about legal systems going and court system going online. So it might be interesting to hear briefly from each how you're carrying out your professional work in this context. and maybe start with this issue about the legal system and the court system.
Right. So I can jump in. As I said in my presentation, family courts often are the least resourced courts in the United States. They already have extraordinarily high case rates, and they're dealing oftentimes with the lowest income of families. And so access to court is extraordinarily difficult. Again, when you're talking about doing something remotely, that assumes that you can have access to some kind of device that allows you to be able to do that you can contact your lawyer, and that you can then participate in proceedings. So all of those are enormous, enormous challenges. I do think courts are beginning to sort this out, but it is, we're seeing it from the sort of lowest level local courts all the way up to the U.S. Supreme Court, which is adapting and now holding its arguments on a conference call. So the courts certainly recognize. I mean, they're the backbone of a democracy. They recognize the need to be able to function, but it's certainly requiring very fundamental restructuring and rethinking.
I'm going to jump in. Bill, do you have one more you want to put to the
Yes,
panel?
this is a question basically. After this is all over, what comes next? This is from Sambas. He's saying, after we overcome COVID-19 for 4 or 5 months, how are we going to get back to normal? How are these children going to get back to normal?
And I think I'm going to let this be however you want to respond to that, or just use it as your concluding remark, because we have about 3 minutes remaining, and we're on a tight schedule. Dr. Salah, you want to?
Yeah, I think as we call it after COVID-19, we want to build better. So we want to build better. We want to empower families and communities. We want to work with governments and help them to have effective policies and practices. I wanted also to add that, which is something that I didn't say, that UNICEF launched last September, family positive policies, for example. And I refer you to see this, how important it is for also to have positive family. So what we need to really build better, start in the beginning with early childhood development, and because early childhood development is not only, to help the child, but it helps the whole society and community, because from all the programs that we have in the world, we know that it helps us to build resilience and social cohesion. But policies are very important, and working with all members of society, and particularly put peoples first and communities first. Thank you.
Thank you, Dr. Salah. Dr. Trask?
I would like to say that, first of all, I'm less optimistic that this will be done in 4 months. I think it's going to be, unfortunately, a longer crisis with a longer term fallout. What we are seeing through this is the importance of human relationships and human connection, and how much we need that as a global world. And so I second Dr. Salek that we need the policies and programs that help strengthen families and that support them all the way across the lifespan, from early childhood. We haven't talked about adolescents and young people. They're the most vulnerable in terms of the economy. They're the ones who are losing the jobs the fastest. You know, we've got over 1 billion adolescents on this growth right now, all the way to the elderly. And thank you for inviting me.
Yeah, well, thank you.
I know we're very, very, very brief on time, so I'll just underscore what both of my co-panelists have said. And really, I think perhaps the most optimistic thing is that this provides us a blueprint to understand the institutions that are so key to our society, from the familial institutions, immediate families, extended families, but all the way up to all of our social and public and political institutions. And we have to keep relying on them and building them and supporting them.
Well, thank you. Thank you all. This was truly an excellent webinar and set of panelists, and just delighted that we could honor the International Day of Families with this important discussion. We had 300 viewers. There is a lot of chat and many applauding your presentations, and we'll get information out to each of you from these chat column comments. Often I hear that my sessions or panels are not gender balanced, and I was a little bit criticized this time for why only women on the panel, so that felt good. We truly had a great session with you. There is a session at the Department of Economic and Social Affairs at the UN at 10:30. If you want, it's in the chat, that link. Conclusion, thank you all very, very much. And thank you to our audience for joining us today. Have a great day.
Thank you very much.
Thank you.
Thank you.